The recipient of the Treasurer's Office Award for Outstanding Achievement in Leadership is Dr. Suzet Mckinney. A nationally recognized public health expert, Dr. Mckinney in January joined Sterling Bay, a real estate investment and development company, where she is principal and director of the Life Sciences Division. She oversees the company's relationships with the scientific, academic, corporate, tech, and governmental sectors, as well as facilitates the growth of life science tenants in Sterling Bay developments. She previously was CEO and executive director of the Illinois Medical District, where she oversaw medical research facilities, labs, a biotech business incubator, universities, 4 hospitals, and more than 40 healthcare-related facilities. That is in addition to many other ways she gives back to her community. But we could go on for a while, but I would rather hear from you, Suzet. Congratulations on being chosen for this award.
Thank you so much, and thank you for having me today. It's awesome to talk with you.
The one thing that does permeate your extensive resume is experience in public health and life sciences. How did you make that decision to enter the field of public health?
You know, I've always said that I got into public health by mistake, but I stayed in on purpose. When I was an undergraduate pre-med student at Brandeis University, I had the opportunity to do a clinical internship with a neonatal perinatal fellow at Harvard Medical School. And I was sitting in the hospital with him one day, and he started talking to me about his researching degenerative eye diseases in infants. And, you know, I was young, 19, 20 years old. And I said, "What are you talking about? Degenerative eye diseases are for old people, not babies." And he said, "You know, that's where you're wrong." And he went into this entire explanation of his study in public health. And I very quickly realized that public health could possibly help me be a better clinician. My plan was to go to medical school and be a neonatologist. But I will tell you that once I moved back home to Chicago, went to graduate school and got that master's degree in public health, I only planned to work in the field for 1 year. But it was so intriguing, the work that I was doing, and I didn't think I could pull myself away from it. So here we are, more than 20 years later. And, you know, as you said, public health has been a thread throughout my entire career.
Yeah, so from working in medicine to overseeing the medical district to now working for a real estate development company. Tell us more about your role with Sterling Bay, because you still did focus in a life sciences division.
Yes. So as the leader of Sterling Bay Life Sciences, our life sciences vertical here at the company, I am responsible for collaborating and coordinating and working across multiple sectors to really advance our presence in the life sciences. I will tell you, I initially became interested in the life sciences during my tenure at the medical district. And at that time, I was working to build a life sciences innovation park in the medical district because we were working to address the extreme healthcare disparities that we were seeing on the west side of Chicago. And without going into all the specifics, what I would tell you is that I realized that by building life sciences facilities and working to attract life sciences companies, I could help improve the healthcare outcomes of people living in vulnerable communities on the west side of Chicago indirectly through their economic outcomes. And that's because the life sciences as an industry is a very large economic booster, if you will. And so when I had the opportunity to come here to Sterling Bay, I still had that in the back of my mind. And part of my responsibility here is to expand our footprint in the life sciences nationally. And I thought, there are vulnerable communities all over this country. There are people suffering from healthcare disparities all over the country. And how amazing would it be having the opportunity to have that level of impact? So that's what I'm doing here. It is so exciting to be here. And I have to be honest, I'm having a great time doing it.
You know, I'm guessing when you started down this road, you didn't see it ending where you are today. Not that it's ended, but being where you are today. But when you look backwards, you can clearly see the experience you had that led you to here. Now, along that road, I know that there are lots of challenges and obstacles, and one that we all face over the last 2 years has been during the pandemic. How have you personally and professionally dealt with the pandemic?
One day at a time, really. Fortunately for me, through my work in public health, specifically in emergency preparedness and response, I've always known that a large scale pandemic coming here to the US was a possibility. In the field of public health, we have been actively planning for a large scale pandemic since 2006 and 2007. So, I have a level of understanding, I would say, that most people probably don't have if you haven't studied pandemics in the past. So I know that these things can span long periods of time. This one has been particularly difficult for all of us. And so for me, I just worked to try to find a bright spot, a bright moment in each and every day. Sometimes that bright spot was, laughing at something that I happened to see on television. Sometimes the bright spot was just having my daughter come and tell me about something going on in her day. But anywhere and everywhere I could find a bright moment, those have been the things that have helped me make it through. Um, Honestly, I thought that we would be out of the pandemic by now. But
Not just you.
that is not the case. So, needless to say, I'm still searching and looking and embracing those bright moments in every day.
Well, you said something earlier that stuck with me, and I'll paraphrase that this wasn't necessarily the path you wanted to go down, but it's where you want to be.
Right.
So for young people out there at the beginning of their careers who have some idea about where they want to go, but maybe a lot of uncertainty, what
Mhm.
advice do you give young people looking to accomplish their goals?
Sure. I tell young people all the time to, well, I live by a motto, and that motto is, go big or go home. And when I'm talking to young people, I explain to them what I mean by that is, set a goal for yourself and pursue that goal as aggressively as you can. And when you reach that goal, set a higher goal for yourself and then pursue that higher goal as aggressively as you can. And, evaluate every opportunity when it comes your way and evaluate it through multiple lenses: your family life, your health, your physical condition, your financial condition. Every single lens that's important to you, evaluate those opportunities. And if it's something that won't kill you, don't be afraid to go for it, because you never know where the path of opportunity will take you. And that has been another theme and thread throughout my career. I had no idea I'd wind up in so many of the places where I've been fortunate to go and had the good fortune to do the work that I've been able to do. But it's really been a result of taking advantage of those opportunities when they come my way, after I've evaluated them, of course, and made sure that they were great opportunities, not just for me, but for my family and others around me. So that's the advice that I give to young people.
I tell people that whatever you do, if it doesn't challenge you, it's not going to change you.
Exactly.
After your words, I'll add, as long as it doesn't kill you.
That's right.
Now, we've talked about your professional career, and you gave a little bit of insight into some personal things, but you also have been someone who has given back to your community, who has volunteered your time. So, to wrap things up, give you words of wisdom you share with individuals who might be want to follow in your footsteps, who want to be agents of change in their community.
Sure. I would say two things. When it comes to pursuing goals and establishing a plan for yourself, decide what you want and then go for it. I happen to be a person that I fiercely compete with myself. Every day is an opportunity to do better than I've done the day before. And I would advise people to recognize that you don't have to shrink yourself just because someone else is uncomfortable with your growth. Um, if you want more, go for more. So that's the first thing. And then the second thing related to that is, as you grow and prosper and evolve and search for more, always look for and take on opportunities to give back. For someone like me, I consider myself to be a leader. And I believe that when you are a leader, giving back to someone who may not be as fortunate, who may not be as fortunate as you are, is a requirement, because it takes those of us in leadership to reach back and pull others forward and pull them up and upwards. So those are my two pieces of advice, I'd say.
Right. Well, Dr. McKinney, thank you very much. We consider you a leader as well, and that's why you're the Treasurer's Office recipient of our award for outstanding achievement and leadership. Really, it has been a pleasure talking with you. We could talk much longer. If people want to learn more about you, it's easy to find information online. Thank you for your time and congratulations.
Thank you so much.